Hey guys, welcome back to another video. So today's case is a 1-month-old baby girl brought to the ER by her mom with concerns over baby's decreased activity level, lack of appetite and worsening diaper rash that has not resolved with usual antifungal treatment. No complications at birth. On examination, the baby is afebrile but is noted to be lethargic with no lymphadenopathy. Lab values revealed elevated levels of adenosine and deoxyadenosine in urine and blood. So the main key points is, first of all, she is a 1-month-old baby girl, and there is decreased activity level, lack of appetite and worsening diaper rash, and which is not resolved by any usual antifungal treatment, and the baby is lethargic with no lymphadenopathy, and lab values reveals elevated levels of adenosine and deoxyadenosine in urine and blood. So the diagnosis is Scid, which is severe combined immunodeficiency disease. It is caused due to ADA or adenosine deaminase deficiency, which ADA helps in the breakdown of purines. This disease leads to low levels of WBC and natural killer cells, which explains the rash, and there is no breakdown of deoxyadenosine, which explains the lethargy and the increased levels of deoxyadenosine and adenosine in the urine and blood. So there can be two cases of Scid, one in which there is complete deficiency of ADA. Symptoms will be seen within 6 months of birth with neurological problems, which is the case with this particular case, as the symptoms started arising 1 month after her birth. Then there is the partial deficiency of ADA, in which the symptoms may appear after a few years. So you may be wondering how this is harmful. Increased amounts of adenosine will lead to abnormal cell signaling within the cells, among the cells, and within the body. Increased deoxyadenosine will bring about cytotoxicity within the cell. So the treatment for this is gene replacement therapy by recombinant technology. ADA enzyme is artificially produced, which is given into the bone marrow, which is deficient with ADA, and it is injected into the bone marrow of the bone deficient with the ADA enzyme. So the summary for Scid is, the patient is immunologically compromised due to decreased NK, natural killer and WBC cells, which explains the increased amount of rashes. Failure to break down deoxyadenosine, which increases lethargy and increases cytotoxicity within the cells. Then failure of breakdown of adenosine, which causes abnormal cell signaling among the cells. These two results in the increased amounts of deoxyadenosine and adenosine within the urine and blood analysis. The treatment is by gene replacement therapy by recombinant technology, which introduces the proper functioning ADA enzyme into the bone marrow. So thank you for watching this video. I hope you learned something about Scid today. I'll meet you in the next one. Thank you.